high definition lipo, smart lipo, vaser lipo, air sculpt. Are you interested in getting chin lipo and confused about all the different options out there? My name is Sagar Patel. I'm a double board certified Beverly Hills facial plastic surgeon. And in this video, I'm going to try to break down all of the different options out there. So as you know, chin lipo is a surgery in which we're contouring the area underneath your chin and jawline. Surgeons out there have different names for things that they do. Most of the time, it's just marketing gimmicks. That's the truth. It's things that we do to help simplify things for patients. And whether it's something called the Wild West lift or the new lift or the facelift, it's all a different variation of a similar thing. Now, when we're talking about lipo, there's different terms out there. Terms like air sculpt and chin lipo and skinny lipo and laser lipo and smart lipo and high definition lipo. And I can go on and on. But what the heck are those? So I'm going to start by telling you the 3 different options that I offer and breaking those down for you. So first of all, we have something called traditional lipo. I use 3 incisions. Now, one of the biggest questions I get is, well, does it make a difference to have the incisions under your chin? I used to do surgery where I only did a central one, but I found the results weren't as good. Now, the reasons might surprise you. Now, just because you only have one doesn't mean you're guaranteed to get bad results, nor does it mean you got cheated or bypassed. I think that on the sides especially, you can get out more fat by making these side incisions. We're able to get from here to here, so we're able to lipo this area. However, when you cross and go back the other way, as surgeons notice when you're doing it, you'll get out even more fat than when you thought you had gotten everything out going from centrally. So somehow going back across the grain of the fat allows us to get out even more. Now, overall traditional lipo, we're removing the majority of the fat, but leaving some behind to help contour and prevent the skin from getting too thin. So if you think about the layers in our neck, we have the skin, the fat, and then the muscle underneath. That's called the platysma. You can feel it when you kind of stretch that area. Now the fat, we want to remove the middle portion of this, and as a surgeon, we're using tools like the pinch and roll technique where you're pinching and feeling the fat, which is once again a super important technique for surgeons doing the surgery awake. This is going to be the critical part of this, is having the feel for the surgeon, and that when the patient is stretching all the fat into one smooth layer by stretching their neck, I can do surgery using 2 hands. If a patient's asleep and going like this, I'm using 1 hand to lift and extend, and then I'm only doing lipo with 1 hand. The second type of technique that I do is called skinny lipo.
So you think I'm skinny?
What is skinny lipo? Skinny lipo is a technique that I invented. What do I do differently? Well, I trust my hands to go very superficial, and instead of leaving any fat behind, we get rid of pretty much everything. All we're doing is we're going superficial, releasing the fat, and then I'm doing that all the way around from the edge of the jawbone. I'm making sure that I don't miss any pockets, releasing everything from around the incision, going up above the incision, up underneath on the sides. I often see surgeons make mistakes by leaving little pockets because, as you can imagine, the area is going to be very close to where you're working. So you have to go what I call short sticking it, which is going really small passes. The key to this surgery is we're going to be releasing all the skin around the area and getting all of the fat. So when the procedure is done, that skin attaches to the underlying muscle and tightens. Very often, the first complaint I get from patients is it feels tight. Now, while that is a downside, the bigger downside is that muscle, which is now adhered to the skin and allows the skin to tighten even more, is more visible. So specifically when we stretch the skin by looking up, you can see that muscle. The benefit of skinny lipo, we get skin tightening and remove all the fat. The downside, we can see the platysma muscle, or what I call platysmal show. Now, last but not least, what is power-assisted lipo? Power-assisted lipo is essentially a tool where I use bigger, longer instruments.
Time to bring out the big guns.
And most importantly, a vibrating instrument. This helps me break down fat, whether it's excessive scar tissue from something like previous chin lipo or previous cadbella, or it's something like a higher volume of fat where I want to remove the fat without getting into bleeding and debulk it as quickly as possible. It allows me to use this power tool to get out as much fat as possible. Often I will also then switch back to a non-grating sculpting tool because the downside of the power assisted is we don't get the feel that I was talking about earlier in terms of feeling the layers the surgeon is in to be able to get superficial to the deep portions, feel the muscle, and know where in that plane we're headed. Obviously, it's a lot easier to use in heavier necks, and that's where it's primarily reserved for. Now, other things you might hear about: high definition lipo, smart lipo, vaser lipo, air sculpt. These are all proprietary terms by their own companies that use devices. These devices cost money. Air sculpt, first of all, is a company that does things a little bit differently. My fear and truth with air sculpt is there's no dedicated literature explaining what they do. There's no video. They just have animations telling you it's different, and there's no scar. I've seen the scars from these procedures. There's no stitches, doesn't mean there's no scars. Two very different things. Most of these tiny cuts we make for this procedure will heal up beautifully without a stitch, but when you put stitches, they heal up even better. Now, moving on to other things, from smart lipo to a vaser lipo, these are energy-based tools that impart energy into the deeper surfaces to provide tightening or a change in results. Now, for the most part, this is unnecessary. If you're a 20-year-old patient and your surgeon's telling you to get vaser, run. Just because you own the device doesn't mean everyone's a candidate for it. And so in the end of the day, you have to be very, very particular about who gets it and who needs it and whether it's going to do anything. I would reserve that for patients who are older, who are afraid of having skin that is going to show more, and they don't want to be too aggressive, and it allows you to have less of a platysmal show with getting some tightening. But by no means is it going to be a belt and suspenders where you can say, oh, my skin would be too loose with regular lipo. If I do vaso, it'll work. It's not going to go that way. There's a reason there's no head-to-head studies of one versus the other. And when I was contemplating buying these devices, did my research, met with companies, the question I asked myself was, is there any vaser lipo result that's better than any of the ones I already have without using X, Y, and Z device? And the answer to that was a definitive no. And until I see before and afters that are better, I don't think I'm going to be buying any of those devices because I'm very happy with the results I can accomplish for my patients. There you have it, a little breakdown before you get too deep into the nitty-gritty of the internet. Remember, there's a lot of different words out there. Ignore the words. Choose your surgeon based on his or her reputation and results. If you have any questions, leave a comment below, like this video, hit that little bell button to subscribe to our channel for more awesome content, and thank you for watching.